Hello, everyone, and welcome. I'm Kimberly Knight, Director of the Caregiver Support Program at the Senior Source. Today, we're going to talk about understanding the difference between Alzheimer's and dementia. These terms are often used interchangeably, but they're not the same. Understanding them is crucial, especially since every 68 seconds, someone new in the United States develops Alzheimer's disease. It impacts millions of families, and chances are you or someone you know is affected. So, exactly what is dementia? Think of dementia as an umbrella term. It's a general term for a decline in mental ability severe enough to interfere with daily life. It's not a specific disease itself, but a group of symptoms. These symptoms can include memory loss, problems with reasoning or judgment, disorientation, difficulty learning new things, loss of language skills, a decline in the ability to perform routine tasks. Many different conditions can cause dementia, some of which are reversible, like thyroid problems or drug interactions. Others are progressive, meaning they get worse over time. Other types of dementia include vascular dementia, dementia with Lewy bodies, frontotemporal dementia, Parkinson's disease, mixed dementia, normal pressure hydrocephalus, Huntington's disease, Korsakoff syndrome, alcohol-related brain damage, posterior cortical atrophy, Down syndrome, and Alzheimer's. So exactly what is Alzheimer's disease? Alzheimer's disease is a specific progressive brain disorder that gradually destroys brain cells. It affects memory, learning, judgment, communication, and the ability to do daily activities. It's important to remember Alzheimer's is not a normal part of aging. It is a fatal disease, and currently there is no cure. Alzheimer's disease is the most common type of dementia. Alzheimer's accounts for 60 to 80% of all dementia cases. At this point, there is no single cause for Alzheimer's disease. Age is the number one risk factor. The longer you live, it increases your chances of developing Alzheimer's. 1 in 9 people 65 years of age and older have Alzheimer's, and when you turn 85 years of age, you have a 50% chance of developing Alzheimer's disease. The two main types of Alzheimer's disease are early onset Alzheimer's and late onset Alzheimer's, distinguished by the age at which symptoms begin. Early onset Alzheimer's occurs in people younger than 65, often in their 30s to their 50s, and is less common but more aggressive. Late onset Alzheimer's is the most common form, with symptoms appearing after age 65. So while all Alzheimer's is dementia, not all dementia is Alzheimer's. The damage in the brain typically starts years before symptoms ever appear. Under a microscope, we see two main abnormal structures: plaques, clumps of protein fragments that build up outside the brain cells, and tangles, twisted strands of protein that form inside the brain cells. These plaques and tangles disrupt how brain cells communicate, leading to symptoms we see. Now, there are 10 warning signs that are crucial for us to be able to recognize. And to remember, these are not normal aging changes. So we want to look at the 10 warning signs. Memory loss that disrupts daily life, challenges in planning and problem solving, difficulty completing familiar tasks, confusion with time or place, trouble understanding visual images and spatial relationships, new problems with words in speaking or writing, misplacing things and losing the ability to retrace steps, decreased or poor judgment, withdrawal from work or social activities, changes in mood and personality. These are the warning signs of Alzheimer's. If you notice these signs, it is important to see a doctor. Diagnosing Alzheimer's involves a comprehensive evaluation, including a mental status exam, a detailed history of symptoms, physical exams, brain scans, and memory and language testing. There is no single test, but doctors aim for about 90% accuracy by ruling out other conditions. While there is no cure for Alzheimer's, there are treatments available that can help manage symptoms for a time. These medications work differently, and your doctor will determine the best option. For example, Some medications help with mild to severe dementia, while others might target agitation or insomnia specifically related to Alzheimer's. It's vital to discuss potential side effects with your healthcare provider. Beyond medication, there's a lot you can do to take care of your brain and support overall brain health. You want to manage your numbers, keep your blood pressure, cholesterol, blood sugar, and body weight healthy. What's good for your heart is good for your brain. Feed your brain. Eat a balanced diet like the Mediterranean, DASH, or MIND diets, rich in omega-3 fatty acids, and consider multivitamins with folic acid, vitamin E, and C. Exercise your body and brain. Stay physically active. Take classes, read, play cards, do crossword puzzles, and constantly stimulate your brain by trying new things. Social interaction is also very important. It's very important before you do any diet, exercise, or vitamin changes to your regimen. You want to consult with your physician first. Understanding that dementia is a journey and you don't have to walk it alone. The Senior Sources Caregiver Support Program is here to provide information, resources, and supportive services to help you along the way. Don't hesitate to reach out to us. You can reach us at 214-823-5700, or you can email us at csp@theseniorsource.org. We are here for you, and thank you.